everyone for joining the community of excellence. So we need everyone to make it possible that the vision of xShare is realized. And this is a vision that relates to every one of us to be able to have our data in a format that allows us to gain actionable insights. But that's only the beginning. Formally, xShare is about expanding the electronic health record exchange format to share and effectively use data in the EHRxF. This slide comes from the European Commission and shows how powerful the EHRxF is in terms of providing rights to natural persons, putting them at the center of their health and care. xShare is active on two pieces of these rights. The first one is the ability to download a copy of your data in a format, in the European Electronic Health Record Exchange format, which is hopefully based on HL7 FHIR, at least that's where we're working on. And the second one is the ability to insert data into your electronic health record. Of course, there is the possibility to access, to see who access the data, set access rights, opt out from primary or secondary use, appoint authorized participants, and request rectification. But our focus is downloading and inserting information in the electronic health record. Next slide, please. So there are three pillars to the xShare vision that anyone can share their data in the format. The first one is the yellow button, the ability to press a button or something equivalent and get your data, or be able to share your data effectively. The second is the hub. This is about tools. This is about specifications that are readily usable. And the third one is the industry label. The idea is to have a partnership between standard organizations, the industry, and authorities, so that we can deliver three types of labels. The first one is bronze, that's a self-declaration. The second one is a silver, which means that there is a report from a testing facility. And the third one is the gold, which means there is a partnership with a jurisdiction, with people, organizations, governments that have actually the right to data holders. Next one, please. So here are the ways that we have considered that you can share your data. You can download them, you can one-time share them with a QR code, and you can link. You can provide a period of time through which you share data between two organizations or two systems, more appropriate, like the way that we share our location with Facebook. In terms of priority data categories, there are 6 in the regulation right now: laboratory results, hospital discharge report, patient summary, imaging report, prescription and dispensation. And there are 2 additional ones that xShare is working on, and we are looking for your contribution. We will be focusing on those soon: our care plans and the IPS Plus, and an extended IPS for clinical research. Next one. One thing that is important, and here is the QR code for you to click on. Until the 31st of August, HL7 Europe is accepting comments on the priority data categories. There are specifications for all 6 priority data categories. Please click on the QR code or contact me or Carolina or someone. The link is there, the QR code is there. Go ahead, please, and provide your comments to create better specifications. Next slide. The second thing that I'd like to celebrate with you, the community of excellence of xShare, is the fact that IHC Europe, in the recent Plagathon, and you will hear more from Eva, managed to push forward with us and the xShare community, and there are lots of people to thank here. The silver label, that's in the middle, and you can see this is an experimental performance testing, since we don't have the final specifications, but there is the commitment of xShare to work with XDHR and align both the specifications and also the actual test cases that eventually will be the test cases that that will be implemented with the support of the European Commission. Here you see what was tested. There was the testing of the download, the upload, and the one-time share with QR codes, smart health links for patient summaries and laboratory. And there was experimental testing for the other categories: hospital discharge reports, prescription dispensation, and imaging report. There were 14 awarded, and there will be another one in 2026. What you will be able to have soon at the website of the European Electronic Health Record Exchange format is the handbook, the registry of products, and so on. So this is extremely important for the expression of interest as well. Thank you. Next slide. We are in the midpoint of our project, and the next thing is to face a huge challenge. And this is where we seek your help as well to spread the word. We would like to commit to more than 100 places where citizens can actually press a button and get their health data. And I don't know how much of their data they get. I hope everything. Next slide. And closing from this small introduction. So the vision is that everyone can effortlessly share their health data with the click of a button. It is based on the visionary Digital Compass 23rd of Europe for a human-centered sustainable digital future. It also grounds on the European Electronic Health Record Exchange format, which fosters citizen engagement, driving research and innovation in the health DS. We are talking about the button and the label, and we are glad to share with you our developments in terms of those. First release of this label in 2025 at the silver, soon also bronze and gold. There is an open call for early adopters now, and I think the community of excellence is instrumental to make it grow. And eventually, the benefits are for the people, for all of us, and also our loved ones and beyond, to simplify sharing of trusted health data, fostering citizen science, strengthening digital resilience, facilitating, actually, this is important for me, actionable insight based on your health data, and eventually for the whole of Europe, advancing global leadership in digital health standards.